There are a lot of reasons why patients may be considering having their implants removed. It may be that the implants are no longer flattering. You may be several children past having your implants, several pounds different from when you had your implants, or several decades later, and it's just not important to you. You might also be having a complication from your implant, such as capsular contractures or tightening of the scar tissue around the implant, or an implant rupture. There are also people who are afraid the implants are negatively impacting their health, and that might be something like a higher risk of a type of lymphoma around certain types of textured implants. And it might also be something that's more poorly understood, but very prevalent on the internet, called breast implant illness. But whatever your decision, it's a fine decision, but it's a difficult one because sometimes patients are actively choosing to have a less aesthetic outcome when it comes to having their implants removed altogether. Now, every patient comes to the table with a very unique set of circumstances. The shape and amount of breast tissue that you have, the volume of your implant, the type of implant, whether it's saline or silicone, and the age of your implant, as well as whether there's a rupture or a capsular contracture, all add to the decision making. You also may not really know what you look like without implants. A lot of time may have gone by. Your breast tissue likely has changed pretty significantly from when you first had your surgery done, if it's been a long period of time. And none of us have the crystal ball of what you're going to look like afterwards. So that adds another layer of stress in trying to make the decision that's right for you. So when we're going through all of our choices, it may be as simple as just removing the implant. This is an easier decision for patients who don't have capsular contractures. Patients that have saline implants, that's a very easy thing to do under a local procedure. And if you have silicone implants, we want to make sure that the implants are intact before we do this simple in-office procedure where all we do is numb up the incision and remove the implants. Now, if you have a ruptured implant or a capsular contracture, this is not going to be our first recommendation for you. Capsular contracture or tightening of the implant scar tissue around the implant can be associated with a higher load of bacteria, and that may be responsible for some of the symptoms attributed to breast implant illness. So if people do have capsular contractures, or if they do have a silicone implant rupture, it's recommended that we go to the OR to remove those implants because likely we will want to remove that capsule as well. Now, if you read on the internet, there are a lot of, I hate to say, kind of non-medical education sites that talk about something called bloc. So the term bloc comes from cancer operations, where you try to remove the tumor as one whole piece to prevent it from spreading. There's no role for bloc resection in patients that don't have cancer. So it's kind of a catchphrase that's used to unfortunately kind of scare people that there's something poisonous about their or cancerous about their capsule. Now, again, there is that type of lymphoma, and those patients may benefit from an bloc. But for all other patients, typically just a capsulectomy or removal of the scar tissue is going to be just as effective. And in early data on breast implant illness, there is no benefit to an bloc resection. So removing the capsule in its entirety can be a great idea for certain patients, but it doesn't need to be taken out in one piece. Now, what you look like once those implants are gone is going to be different for every patient. Some patients that have a lot of breast tissue and some breast implant droop or ptosis may be good patients for having a mastopexy. If you have smaller breasts and very deflated tissue, it may not be something that's going to add any aesthetic benefit. So just picking more procedures to add on doesn't necessarily mean it's going to look better. If you're interested in adding some volume back, not lots of volume, because that's not typically possible in one stage, and you're also a good candidate for liposuction, sometimes we can add fat transfer. especially up in the upper portion of the breast where you may lose more of the volume once the implant is out. Now, this is going to be very different from patient to patient, and you really do have to have quite a bit of breast tissue to make it worthwhile. In all situations with fat transfer, the best results may be after doing multiple fat transfers to get you where you want to go. We're a little bit limited in how much fat we can put in at the time of surgery. So for some patients, it may be best to approach this stepwise, because you don't know what you're going to look like and we don't know what you're going to look like once the implants are out, and further reconstructive or aesthetic options may be best delayed. We try to make the best choice possible to limit surgeries, but again, we don't have a crystal ball. So what you can do in getting ready for this appointment is please try to get any records that are available to you. If you had a card that has your implant information, everybody was given this at the time of their surgery, but a lot of people didn't keep track of it. That card will help us a lot because it will tell us the type of implant and the size of the implant that you have in. Also, if you've had your surgery within the last 7 years, any pre-op photos or implant information or operative report that you can gather for us would be exceedingly helpful. If you haven't had breast imaging for breast cancer surveillance, like a mammogram, we do require that in all patients over 40 and recommend it in all patients over 35. And if you have silicone implants, an ultrasound or an MRI can be helpful to know if you have an implant rupture. So hopefully this is helpful in getting ready for your appointment. Again, any old records will be very helpful for us in decision making because we'll know how big your implants are, and a physical exam is also really important. I wish I had more data for patients that think they are experiencing signs of breast implant illness. There is an ongoing study right now, and early data shows that only 8% of patients in that study group had a complete resolution of their symptoms after removing their breast implants, and unfortunately after 6 months that number dropped to only 4% having a complete resolution of symptoms. Now, there were patients who had partial resolution, and that number was high at 80% immediately after their surgery, and unfortunately this also dropped by about half after 6 months, dropping to about 43%. I do think that patients who have an autoimmune disease are at higher risk of symptoms from having a foreign body, and I do also think that those with capsular contractures that we know are related to bacteria may be having an immune reaction to that. So I do think that those patients are probably going to end up being maybe a higher success rate. So again, we can talk about what's known when you come in for your appointment, but that's the best data I have as of November 2020. So we look forward to seeing you. Again, try to bring as much information as possible, and at least this can help you start thinking about the process of how we decide what might be best for you when removing your breast implants.